Hi, I'm Dr. Jean Magallanes from Beyond Therapy and Wellness, and today's topic we're going over is sciatic nerve pain. The sciatic nerve is the largest nerve we have in our body. It goes all the way from our low back to our feet. And so when this nerve is affected, it can be very bothersome and frustrating. Involvement of the sciatic nerve can be due to several reasons, which means sciatica is not the diagnosis, but an effect of an underlying condition. Some of these conditions could be a narrowing of the spine, which is also called spinal stenosis. It could also be due to a disc herniation. Another reason it could be affected is due to a muscle compression. That muscle that is very important is called the piriformis muscle, and you can see it right here. So the sciatic nerve exits right underneath the piriformis muscle, and that could be why you're getting some sciatic symptoms down your leg, is because that nerve is being compressed. So now what I'd like to do is show you some early intervention exercises that you can do to hopefully get some good pain relief and improve your symptoms. Okay, so the first exercise I'm going to be showing you is called the Piriformis Stretch. What this is going to do is going to stretch out that muscle in the back, the piriformis, which is the muscle I just went over, because that nerve comes right underneath. So what I'm going to have Mecca do first is I'm going to have her bring her foot over her knee. She's going to sit with good upright posture, and then she's going to lean forward. What you should be feeling is a nice good stretch in the back of your hip, stretching out that muscle. Good. And then what she's going to do is she's going to hold it for about 30 seconds, and you can do 3 on each side. And it should be a nice gentle stretch, nothing too aggressive, because that muscle can be irritated. Okay. And next, we're going to move on over to the table. Okay, so now we're at the table, and I'm going to show you 2 additional exercises that you can do for sciatic nerve pain. The first one I'm going to show you are called pelvic tilts. What you're thinking about with this exercise is you're thinking about your hip being a bucket of water tipping back and forth. So what I'm going to have Mecca do is I'm going to have her tilt her pelvis forward, creating a slight arch in her back, and then tilting her pelvis back, flattening her back against the table. What this is doing is bringing some mobility to the low back, as well as stretching out some of that tissue in the front and the back, hopefully giving some pain relief. And she's just going to do that a couple more times. You can either do this for a set number of reps, or you can set a timer for a minute or 2 and just kind of go into that motion with your pelvis. The next thing I'm going to have Mecca do is called sciatic nerve glides. You can't stretch out nerves, but you can kind of floss them. You can get some mobility in the nerve. So what I'm going to have her do is she's going to bring her leg towards her. Now, starting at this position, she's going to bring her leg up. Toes are going to be towards her, and then toes up, and then bring the leg back down. Okay, and let's do that again. And we're going to bring toes towards her, toes up and back down. It's also creating a slight stretch of the hamstring muscle and calf muscles, which is also bringing some flexibility to the leg and that hip. Okay. Everything should be nice and gentle, nothing causing too much pain. Stay within that tolerance. So after this, like I said, these are early intervention exercises. After this, we would progress to more stabilization and strengthening of your hips and back to offload that nerve and to decrease that cause of pain again. So if this pain is persistent or severe, I do recommend you going to your physician or your physical therapist to check in to see what's going on with your pain and to hopefully give you some pain relief. So thank you for watching this topic of sciatic nerve pain.